How is a TB biopsy performed? Have you ever wondered how doctors confirm a tuberculosis infection when other tests just don't provide clear answers? A tuberculosis biopsy is a crucial procedure that helps obtain a tissue sample from areas suspected of infection. This is especially important when tuberculosis affects parts of the body other than the lungs, known as extrapulmonary tuberculosis. Let's walk through the steps of how this procedure is performed. First, the healthcare provider identifies the biopsy site. This decision is based on the patient's symptoms, imaging studies like chest X-rays or CT scans, and a thorough clinical examination. The affected tissue could be from lymph nodes, lung tissue, or even other organs. Next comes preparation and anesthesia. The area where the biopsy will occur is cleaned and sterilized to prevent infection. Typically, local anesthesia is administered to numb the skin and underlying tissues. This helps minimize any discomfort during the procedure. When it comes to sampling the tissue, there are a few techniques that might be used. The most common method is a needle biopsy. This can be either a fine needle aspiration or a core needle biopsy. Using imaging guidance, a thin needle is inserted into the abnormal tissue to withdraw cells or small tissue cores. Fine needle aspiration collects fluid or clusters of cells, while core needle biopsy retrieves small cylinders of tissue for more detailed analysis. In some cases, a vacuum-assisted biopsy may be employed, using a vacuum device to help pull tissue into the needle. If the needle biopsy is not sufficient or feasible, a small surgical procedure may be performed to remove a larger tissue sample. After the biopsy, care is taken at the site. Pressure is applied to stop any bleeding, and a sterile dressing is placed over the area. If the biopsy involved the lung or pleura, a chest X-ray may be done afterward to check for complications like pneumothorax, which is air leakage into the chest cavity. The collected tissue is then sent to a pathology lab for analysis. In the lab, the tissue is examined under a microscope. Special staining techniques are used to identify the presence of acid-fast bacilli, the bacteria that cause tuberculosis. Cultures or molecular tests may also be performed to confirm the diagnosis. Typically, a tuberculosis biopsy takes about 30 to 60 minutes and is minimally invasive, often not requiring sutures. This procedure is vital when other tests, such as sputum tests or skin and blood tests, do not provide clear results or when tuberculosis affects areas outside the lungs. It's important to remember that a tuberculosis biopsy should be performed by trained healthcare professionals in a controlled environment. They follow strict infection control precautions to prevent the transmission of tuberculosis. The results from this biopsy play a significant role in guiding treatment decisions, helping to confirm whether a patient has active tuberculosis disease or latent infection, especially in complex cases. Always consult with healthcare professionals for personalized medical advice regarding tuberculosis and its diagnosis.